All right. So my name is Cheyenne Martin. If this is your first time joining us, welcome. I'm the program manager for the South Texas Community Health Worker Workforce Preparedness Collaborative. We've been around for about 2 years, and we're a consortium of training partners and workforce development and specialists across South Texas. And our goal is to bolster the community health workforce in South Texas, which means providing professional development opportunities. We just wrapped up a 1.5-year series on soft skills. We discussed challenging conversations, finding mentorship, building your career pathway. And now we're really excited for today and the next 7 months to be launching a new series on public health skills for community health workers. During COVID, it was clear that community health workers are a part of the public health workforce, but so much of the training is ad hoc. You all are thrown in. And it's important work. And so we want to make sure that you are skilled and prepared. So we are starting this series. There's 7 courses, are 1.5-hour modules. They're all state certified. We will take a break for December, but continue out through March, and you'll get to interact with some faces you've seen before, and as well as some new faces. So as long as you're registered, when you register, you have the chance to sign up for all of them or just some of them. I did learn that when you register, the reminders go out. Even if you didn't choose today, the reminder went out to you. So even if you didn't check off the box for a certain date, you'll still get the reminder. So you can make a decision that day if you want to join. So today we are going to start with an introduction to the role of CHWs in public health. Before I turn it over to our speakers, which are Vanessa Saria from Cardea and Belle Flores from the South Coastal Area Health Education Center, I want to say there's a lot of people on here, which is so exciting. Just so please mind your mute button. There will be times to come off and talk. We really want to hear from you. And if you're talking, we'd love to see your face and able to see you. If you're joining by phone, please send me an email so I can send you the QR, the survey to get your credit afterwards. What I'm going to do is to get the continuing education credit, I will send an email to everyone who joined today. So I will distribute that survey by email, not at the end of the webinar, because we have so much to cover and I know people are busy. We would like you to be around for 1.5 hours, but we will try to cover as much as we can in that first hour. All right. And then if you haven't already, please put your name and CHW number in the chat box. That helps as a backup for when we are submitting for your credit to the state. Let's get started. I will stop sharing my screen and turn it over to Belle and Vanessa.
All right, thank you. Welcome, everybody. I just need to get the screen up here. And since I'm managing the
for me. It's email. Then you please have to send it today. She said that.
So Cheyenne, I don't know if you can help me presenting the slides, or do you want me to go ahead and share it? I can't hear you.
I would love for you to share your screen.
Okay, so Belle, it would be great if you can, because I'm sharing the screen. If
Vanessa,
you can...
fair warning, I'm about to mute everyone and then you'll unmute yourself.
Got it. Thank you.
Okay.
Okay. I'm trying to get this into, there we go. All right. So welcome everybody. My name is Vanessa Saria. I'm the Chief Program Officer with Cardea. And Cardea is a certified training provider for community health workers in Texas. I'm going to be co-facilitating the session today with Belinda Flores. Belle, you want to introduce yourself?
Yes, good afternoon, everyone. My name is Belinda Flores. I go by Belle, and I'm the Center Director of South Coastal Area Health Education Center, better known as an AHEC. Welcome.
Thank you. All right. So this curriculum was developed by me and Belle, but also Dr. Rosa Maria Murillo from El Buen Samaritano, who does service the Central Texas community. And we did this in collaboration with the South Texas Community Health Worker Workforce Preparedness Collaborative that Cheyenne just shared some more information about. As Cheyenne explained, this session today does have CEs, continuing education credits for community health workers. And so please make sure you complete the evaluation at the end and provide your CHW number to Cheyenne. All right, so this is how today, this is the agenda for today. We're going to do an intro to public health. We're going to talk about the role of community health workers, their competencies. We're going to review essential public health services and the role of community health workers in delivering those essential public health services. So the objectives for today are to define public health, describe core public health competencies, describe essential public health services, and explain the role of CHWs in delivering essential public health services. So before I go there, I just wanted to say and just kind of reiterate what Cheyenne was saying is that, the CHWs have been responding to many public health emergencies and issues for several decades now. And although I think the work has been done for hundreds of years, it's just now we're calling, now we're putting a name to this important public health workforce. And so community health workers are being recognized as an essential component, essential workforce that is part of the public health workforce. And so I'm not sure that community health workers always recognize that the roles and the things that they are doing every day, the tasks they're performing every day, and the support they're providing to the communities is very much aligned with what the public health workforce is being called to do. And so hopefully by the end of the session today, you'll have a better appreciation for everything you do every day to help address these public health issues. So I'll turn it over to Belle for intros. Although I don't know if you want to go through all of the introduction, Belle.
Yeah, I think we'll skip introductions because we're so many. When we presented this this presentation the last time, it was just a few of us, so we had time. But by the time we get through everyone, we would probably end with the whole hour and a half. So welcome everyone, and like Cheyenne said, if you'll please put your name and CHW number in the chat, that would be greatly appreciated. And we do appreciate you taking the time to be spend this time with us during your lunch hour. So thank you.
Thank you. So again, put your name and organization in the chat. That would be great. And if you don't mind, maybe even add your favorite vacation place. All right. So according to the American Public Health Association, public health promotes and protects the health of people and the communities where they live, learn, work, and play. And pray. That's when people add that too. So what is public health? Public health is many things. As you can see here reflected in this wordle, it's prevention, it's leadership, it's vital statistics, it's looking at our drinking water, air quality, birth defects, healthcare system, substance use, our education, irrigation, behaviors. It's all encompassing. So what I'm going to do now is I'm going to stop share, and I would like to, I'm going to put this video in the chat so that we can watch it together.
Hi, my name is Mighty Fines. I'm an expert with the American Public Health Association, and today we're going to talk about public health. Let's say
We
someone
can't see it, Vanessa.
I know, I'm trying to
the
get to it.
doctor prescribes some changes to their diet and exercise, and maybe even medication. and over time
sorry.
they get healthier. Our hypothetical heart patient is doing great now, but they could have been one of the 655,000 Americans who die of heart disease every year, according to a 2020 report from the American Heart Association, which is a lot of people our healthcare system needs to care for. And that's just one disease. So instead of treating people individually after they get sick, ideally, we just keep everyone healthy in the first place. That's where public health comes in. Public health can be tricky to define, partly because so many factors influence health. In ancient cities, public health interventions focused on sanitation, but also city planning. Over time, public health started targeting specific groups of people like factory workers. In industrial era Great Britain in the 19th century, years of protesting led to better working conditions and fewer workplace deaths. Those were public health efforts too. These days, public health efforts often focus on addressing the systemic inequities that impact health, which are the differences in things like where we're born, where we work, and where we live that determine our access to the resources we need to be our healthiest selves, like safe drinking water and reliable healthcare. Research based on US Census data from 2010 through 2015 shows that people living without these resources can die up to 20 years earlier than people living just a short distance away. Studies like this are an example of public health's population-based approach, which focuses on societies as a whole rather than individuals. A population-based approach can be used to inform educators, policymakers, and community leaders, all of whom play different roles in improving the health of the community. And like that census study showed, health issues aren't caused by any one thing, so they can't be tackled by any one solution. Take automobile safety. From 1979 to 2011, motor vehicle crashes in the US decreased by more than 41%, which took a variety of strategies, like increased education, stricter laws around seatbelts and speeding, and improved design and use of child car seats. It wasn't a single strategy or solution, but multiple players working together to address the same issue from different angles, which is important because our societies don't treat people equally and different people have different needs. And the best interventions don't just focus on the present. Public health experts call this an upstream focus. Instead of just focusing on the issue and the problems it causes downstream, we look back upstream at the causes of potential health issues and how to prevent them. Like tobacco use. Despite several downstream measures to get people to stop using tobacco, from increased taxes on tobacco products to images of diseased organs on cigarette packaging, it remains a leading cause of death in the US, which is why intervening upstream in preventing tobacco use is so important. Prevention could look like state-mandated school materials on the health impacts of tobacco, or legislation that bars tobacco companies from advertising to children or communities with high rates of tobacco use. The goal is to prepare future generations to choose and maintain healthy behaviors. Finally, just like we use a population-based approach and focus on groups of people rather than individuals, effective public health interventions are holistic, which means they treat health as a whole rather than a single aspect. So public health efforts to address heart disease could look like repairing sidewalks or creating parks in an under-resourced community. This would encourage people to get active, improving their physical and mental health. So overall, public health includes all of the organized and holistic efforts to improve policy, education, and access to make the healthiest choice the easiest choice for everyone. If you want to learn more about public health services, check out the Center for Disease Control's 10 Essential Public Health Services Guidelines or the APHA website. Thanks for watching. This video is a part of a series created by Complexly and the American Public Health Association to shut up. To learn more, visit APHA.org.
All right. Thank you. Okay.
The following episode contains
Oh,
information about
sorry.
violence, and some audiences
Let
may
me-
find it triggering. or
Sorry, let me
traumatizing.
turn that
Hi,
off.
my name is Mighty Fine. I'm an expert with the American Public Health Association.
Sorry about that. That's the trick about trying to present and show the presentation at the same time. Okay. All right. Okay, so you might be familiar with some of these key public health organizations. These are organizations that are engaged in control of disease, promotion of health, as well as preparedness and disaster response, both natural disasters and human-made threats, like 911, for example. So here probably are very familiar with the Texas Department of State Health Services that was established in 2003. That is a key public health organization in the state of Texas. And they actually help certify our community health workers in Texas. So, Belle, do you want to take it from here in terms of what public health emergencies have you helped your community respond to? Or do you want-
Sure.
Okay.
Sure, sorry. This presentation was also in partnership with Dr. Murillo, so we're taking up some of her slides, helping with some of her slides. So public health emergencies, what's been, as you see in this slide, the biggest public health emergency that we've seen that impacted our whole world was the COVID pandemic. And so I don't know if some of you just want to unmute, or if there's been other disasters in your or public health emergencies in your community. If you want to just unmute and real quick, what was your role? Nothing lengthy, you know, but maybe your role during this emergency. Anybody that wants to unmute real quick, or maybe even put it in the chat.
Hi, my name is Alexandra Hansen, and I worked at UT Southwestern Medical, and I was doing the PCR testing for the employee health. And so I was doing pipetting the specimens into the specimen jars for the clinicians to put in the Abbott machine for testing. So I did that for a little bit, and then I also moved up and did RSV and COVID-19 and flu as well.
Thank you for sharing, Alexandra. I saw that Angela had put in the chat that she helps with the hurricanes because Corpus is in South Texas and we do get hurricanes. So Angela, do you want to share a little bit about your role if there is such an emergency?
Hello, can you hear me?
Yes.
Hi, good morning, beautiful Belle. Good to see you.
It's
So STEER is a program where we funnel individuals who have no way to get out of Corpus Christi in the need of an emergency. This was enacted after Hurricane Katrina, so we have to evacuate the city quickly. There's a couple of partners of us that get residents out of harm's way, and my role is with the Corpus Christi Housing Authority.
Thank you, Vanessa. Thank you for sharing. I think Steve also put that he was a custodian at the time and still had to work to keep the buildings ready for the next day, right? Whenever there's missions. So we all have a role to play as community health workers. Many of us helped with food distributions, with at the beginning, where can I go get a COVID vaccine? Where can I get a COVID shot? That kind of thing. So we were able to help with that. Many of our communities also were not trusting the vaccine, right? So as community health workers, we had to be that go-between and explain how the vaccine was safe, how it would protect you, you know, things like that. So encouraging people to be proactive to get vaccinated. So again, the role of the community health worker is vast. It's, you know, extensive. There's many things that we help bridge gaps for our community members when it comes to that emergency or meeting that need of that community.
Thank you. Okay. So what is public health? You can see here, this is from the Institute for Clinical Systems Improvement. It's called Going Beyond the Walls, Solving Complex Problems. Public health is a complex problem. A simple problem might be, how do you use a recipe to make your dinner? A complicated problem might be how you fly a rocket to the moon, because people understand, like, there's a lot of factors that you can control. But when it comes to public health, there are so many different variables that come into play around human behavior and unexpected events and the system that makes it very complex. Some studies have shown that having a doctor and being able to have access to healthcare is only 20% of the public health solution. It only contributes a small part, a very important part, very necessary, but it's still not the major contributor to somebody's public health. Other factors are health behaviors like tobacco use, diet and exercise, alcohol use, sexual activity. Those are behaviors that humans have choices around and control. Another one is the physical environment, whether you have clean water and air, sidewalks that you can walk on, parks. And the other one is social economic factors like education and job status. Do you live in a community that does not have quality education or does not have the work to be able to make a livable wage? Does a family have the family and social support and the income and the safety in the community to be able to be healthy, to meet their full potential? So I would love it if you could please put in the chat. Would like you to share what contributes to the health of the community you work with. And I would appreciate, Belle, if you could monitor the chat because I can't see it from here.
We have well-being, diet and exercise, vaccines, enrolling for benefits, finding healthy foods and food options in their area, helping with education, transportation, access to healthcare, the importance of education also, helping elderly with transportation, doing cancer screenings, helping with financial assistance, affordable housing, having good food options, having safe housing, increase the education on prevention, helping with job stability, providing mental health resources, helping with physical therapy and occupational therapy, that kind of thing, being an advocate and helping with advocacy. And they just keep coming, Vanessa.
Awesome. I'm eager to look at them all. Thank you. Exactly. And as Belle said, community health workers do so many things. They do so many important things that contribute to the health of individuals, families, the community, the world. So thank you. Okay. So in addition to all of those things that you mentioned, those are social determinants of health. So you can see in this, and the Kaiser Family Foundation put together this health disparities are a symptom of broader social and economic inequities framework. And you can see that they've laid out some of those key social determinants of health in each one of these columns. And many of you mentioned some of these things, but you also have to overlay racism and discrimination. And I would love for you to put in the chat, or actually it would be great if we could hear from 3 people, how racism and discrimination can impact access to and promotion of the social determinants of health.
We did get in the chat that there's not trust. Maria Bustamante, you can go ahead and speak, unmute and speak.
Hi, we work with farm workers and their families, and racism and discrimination play an important impact in their access to healthcare, and basically discrimination. They feel discrimination on their legal status as well. Is something that affects them, and language, right? Racism about language, not knowing English and being able to communicate. So those are some of the factors that we have encountered.
Thank you, Ms. Bustamante. Also, Vanessa, I did want to mention that in the chat, someone put the fact that the rural communities also suffer.
Got it. So that
My-
can be a different kind of, that can be like a sourcing and where funding goes and where voting power goes as well. That's something that can align with that.
Because it was said also that migrant workers moving from one state to another.
Thank you. Okay. Trying to proceed. You know how I have challenges proceeding to the next slide. Let me see. Oh my goodness. Okay, here we go. All right. So next up, Belle is going to talk a little bit about community health workers. And if you can go ahead and lead this piece. Thank you, Belle.
Sure. So before I share about who are community health workers or what a community health worker, I'd like for you to either chat or unmute and just one word that describes a community health worker to you. Involved advocates. One word. Empathetic, dedicated educators, caring, connector, helpful, resilient, passionate. Another resilient, hope, service, ethical, navigators, coordinators, involved in community, passionate, linkage, understanding, supporter, navigator, a voice, awesome, resourceful, have to be compassionate, supporter, unbiased, very good, thank you, trust, right? Resourceful, empathetic, listener, and a good listener, right? Being impartial. All these words describe a community health worker, a bridge, right? A bridge, a connector, right? So thank you all for sharing. So community health workers, like Vanessa said, have been around for many, many years and all over the world. They have helped in other countries with contraception, with vaccines, all these kinds of things. Here in our states, we are the connectors, we are the advocates, we're advisors, we may be known as promotoras or promotor de salud or CHWs, community health workers, right? But we're that linkage from for the community to health, right? We don't even have to say healthcare. It's to health in general, because we're that connector, because many things impact our health along with healthcare, right? So that access to healthcare, the access to fresh fruits and vegetables, the access to water, the access to transportation, things like that. So community health workers, and this presentation is very important. And I love doing this presentation with Vanessa because of her knowledge in public health. And so the work that community health workers is so linked and is so much part of public health that we want this presentation to bring that to a reality to us, that the work we do impacts all of public health. So thank you, Vanessa.
Thank you, Bill. And I want to say that when I heard people using the word trust, listening, empathy, unbiased, all of those things contribute to addressing racism and discrimination, which can be very critical to engaging people in services and care and supports. So appreciate that. Thank you. All right, next we're going to cover core competencies related to delivering public health services. And core competencies are a roadmap for public health care career development, performance assessment, and improvement. This is according to the Arnold School of Public Health at the University of South Carolina. So you might be familiar with the competencies on the left. For those of you who went through the certification process, the courses were aligned with these competencies, and all the continuing education credits and professional learning opportunities are aligned with these CHW competencies listed on the left. These were developed by the Department of State Health Services, and frankly, we were one of the first states to be able to develop a set of competencies and begin to certify community health workers. Now there's a lot of efforts at the national level to do the same. So on the left, you see communication skills, teaching skills, and so on. On the right, you see the public health competencies. So this was created in a partnership between the academic world and public health Centers for Disease Control and other public health agencies, and it has 8 domains as well. As you can see that some of these areas, some of these competencies like communication skills is pretty simple, that there's alignment between what the public health competencies are and what community health worker competencies are in Texas. However, there are some big words too, that policy development, community partnership skills, data analytic and assessment skills, and so on. So we're going to go through these today to kind of like explain in more simple terms, what these mean and what the work that community health workers do aligns with these public health competencies. Now, I want to say that these are competencies, the public health competencies on the right, they are tiered. So when you go deeper into it, there's 3 levels. They look at frontline and program support staff, like community health workers, community educators. Then you have program management and supervisors and senior management and executive leadership. But every tier does a little bit of this work, and we're going to talk a little bit more about that. All right, so communication skills. So community health workers, they know what communication strategies work well for the community. That was definitely very evident during COVID, when messages that were being developed at the national level were not resonating with people in the community. And community health workers really had to, through trusting relationships, kind of help explain and be like a translator for what was being messaged at the national level and the way the communities were accepting those messages. Community health workers also bring lived experiences into meetings and planning, and they provide a reality check. Many times you have large public health departments coming up with solutions and ideas that may not really be feasible and acceptable by communities that they're trying to encourage to use these solutions. And so community health workers can, because they know the community, they know what works and what doesn't work. In terms of policy development and program planning skills, some community health workers may think that they don't do this, but you do. Many of you participate in community health assessments. There are public health departments who are doing the community health assessment and improvement plans. There are a lot of planning efforts and community conversations where agencies are taking feedback so that they can understand what's happening in the community. So part of planning is assessing about what's going on in the community and then figuring out what strategies and action is needed. So, and policy development goes into, we'll talk a little bit about that later, and it's just like some of those policy barriers that need to be addressed, maybe eligibility criteria that prevent people from accessing services, or even limitations on what counties have access to services, for example, because of the rules. Then there's community partnership skills, and this for sure, community health workers do every day. They establish and maintain relationships that improve community health and resilience. And we'll talk a little bit more about that. I don't have to go big into this because you develop relationships with so many different organizations. It's so essential to linkage for mental health, for healthcare, for education, for workforce, for jobs. There are many partnerships, food access. Then there's data analytics and assessment skills. And again, that goes back to the planning piece that we were talking about. Again, community health workers might see this terminology and say, I don't do this. Well, yes, you do. When you're doing windshield surveys, when you're knocking on doors, when you are finding out what's happening on the streets, in the communities, you are assessing public health conditions. And those are really critical, and you are analyzing how much you're seeing. Like during COVID, it was really critical. Community health workers knew which pockets, which areas were most affected, and they were very helpful in figuring out where we needed to concentrate resources. So we just we just covered those 4 essential skills on the right. And next, I wanted to just ask you, maybe just put in the chat, or maybe if I could hear like from 3 people, did you know you were doing these things? Did you know that you were doing communication skills, policy development, program planning, community partnership building, and data analytics and assessments?
Mostly yes, some not really, and no, in the chat, Vanessa.
Okay, so that is the purpose of this presentation today, is to help you realize how you are contributing to these, how you have the competencies and how you are contributing to the public health workforce. You do these things. So when you are writing your resume, or you're seeking jobs, or you are in interviews, it's important to say, yes, I do these things. All right, thank you. Next, we're going to be discussing the next 4. So, health equity skills. These are, somebody used the word advocacy when Belle was asking for input on one word. Advocacy is critical. Again, going back to trust, listening, empathy, unbiased, working with migrant workers. All of that has to do with health equity, social and environmental justice. Embracing diversity. Embracing through diversity through empathy and helping everyone, reducing barriers and enhancing access to resources. Many of you mentioned that. And I'm glad that this was added. I'm glad that this is being focused on at the national level. Public health science skills. This is a term, again, that people may not think that they're doing, but again, that has to do with figuring out what works and what doesn't work. Because of what works, and if you can do it repeatedly, it works over and over and over again, you're kind of proving that that solution is effective. So the community health workers use information gathered from the community to figure out what will work and what will, and also have input on what doesn't work. And they contribute to the knowledge base for trying to figure out what are some promising practices that need to go into place. Next is leadership and systems thinking skills. Some people think they are not necessarily leaders or system thinkers. However, you are working through a person-centered approach. When you are meeting with a person and you are connecting them to healthcare, to jobs, to housing, you are thinking, what's the system, or what is the constellation of needs that that person needs to be able to improve their health? And that is systems thinking. When you are developing partnerships and you are connecting the dots of how this person needs to connect to these different services in that continuum or constellation of services, that is system thinking. And you are leading by recognizing what needs to happen, and you are making those connections and forging those partnerships. You are also informing the vision for community health. What people consider to be healthy might look different for your community. And so I actually want to stop here right now, and I want to ask you, what is the vision for, when you're working with the community, what is their vision for their health? What are they trying to achieve?
In the chat, we have survival. Each person is trying to achieve something different. Consistency. They want improvement, better health for their families. They want access to care. Somebody wants you to clarify your question if you could.
That's exactly it. Like, for example, survival. Some people might be thinking way beyond survival. But some people, that's where they're at. And so understanding where they are, what is their vision, it's making it through the day. So that's the difference. I hope that it kind of explained it. Essentially, what I'm trying to say is, does the person want? What are their aspirations for their life? Not based on other people's opinions, but for themselves. Okay, thank you.
Better living, quality of life, a better life, affordable care. And some are just dependent on what the crisis is at that moment.
Exactly. Thank you. So next is management and finance skills. And again, you may not know that you do this, but you do. When you are putting together community education sessions out in the community, you're finding spaces and you're figuring out how you're going to get someone to pay for food for those events, and how you're going to pay for printing for flyers. And you're having to like figure out the budget for these things or for programs. You are doing management and finance. You are performing management and finance skills. So we covered the last 4. Again, anything stick out for you? Like, I'd like to maybe in the chat, how are you using your management and finance skills? I'd really love to hear some of your input.
By mentoring and supporting other CHWs, by organizing health fairs, by providing education materials, by helping with time management. Again, by budgeting, helping budget with the resource that they have, using all available resources, helping with overall better living conditions, organizing conferences, health fairs, events, navigation, trying to navigate resources, educating people on overall wellness, finding food resources and housing.
Yeah, that's like big words, resource management. Thank you. That's awesome. I always love to hear people's feedback, because that's exactly all those things that you're doing is management and finance skills. And again, I was saying these are tiered. So what you might do is be out there and organizing community fairs, but you know, and a person who is an executive in the public health realm might be managing the budgets of multiple public health agencies that are millions and millions of dollars. But it starts, you know, you have the more the community-based projects. All right. So, essentially, so earlier in the video, then when the presenter was talking about the efforts to address policy and programming around tobacco prevention, he mentioned the 10 essential public health services and skills. So this is a framework that was created. This framework has been around for a while, but in recent years, it was actually updated to center equity. You can see equity in the middle, right? And it has 3 major areas. It has assessment, policy development, and assurance. And we're going to go through each one of these areas. So assessing is about assessing and monitoring population health, investigating, diagnosing, and addressing health hazards and root causes. So what could that look like? You know, that could be like, maybe there's contaminated water, or maybe there are carcinogens, things that cause cancer in the community. And so you're seeing people get sick, but you know, maybe that there's something in the environment that is affecting people. Policy development, again, that goes to informing and educating around what is needed to change, to drive policy change to improve public health. And then assurance is more like just making sure that you have a sustainable workforce and system to infrastructure to support. So we're going to go into these things a little bit more. All right. So Belle, you want to go ahead and start with this, or do you want me to explain the assessment and then you want to ask the question? Okay.
Yes.
Okay. So again, back to assessment. There are you can see here, the way that this is organized, the assessment has two little blocks there, the red one and the orange one. So I'm going to kind of, each one of these slides has those two components. So assess and monitor population health, investigate, diagnose, and address health hazards and root causes. I kind of covered that a little bit when I was talking about understanding what's happening in the environment, or what's happening with certain diseases in a community, and working to like figure out what's going on, what is going on in the community that is impacting public health.
So again, as Vanessa was saying, what is the role of the CHWs when we're trying to show how the work of a CHW is work that is part of public health. So in this wheel, the 10 essential public health services, the assessment part, think about a time when you helped identify, when you helped with something that was impacting public health, like a public health issue. And what was your role as a CHW in helping with that issue or with that problem at that time that was impacting your community? Assessment, put down identifying food deserts, right? Maybe, very good. There's a food desert, then can we work with our local food, what are they called? Food, I think of
Distribution centers,
yes, food.
farm.
Food banks, right? That assessing, right? How about COVID? Hurricane victims also, right? Where are they going to go to if they don't have transportation? If people don't have insurance for, and I'm reading these from your chats. If they don't have insurance for medical care, helping them with Medicaid or Affordable Health Act. Again, for the food deserts, right? Having a food pantry, these kinds of things. Housing, affordable housing. Very good. So again, part of the work that CHWs do fits right into the public health framework, that wheel. So the assessment, again, is thinking about the times when we've had to assess what's going on, and then how are we going to meet this need that's in our community.
Thank you, Belle. Thank you. So next is policy development. Again, I'm going to go back to the wheel. You see that the orange, the yellow, the two oranges, the green and the green, those are the four components. And these are them here, 1, 2, 3, 4. So they are communicate effectively to inform and educate, strengthen support, and mobilize community partnerships, create, champion, and implement policies, plans, and laws, and utilize legal and regulatory actions. So what is this? Again, this is about educating the public, or even doing advocacy to advocate for what change is needed, and being able to communicate that in a way that is impactful. The legislature loves to hear with people with lived experience. They want real examples of how communities are being impacted. And many times community health workers are able to tell stories that are much more impactful than a whole bunch of data. Those stories really humanize the issue. Next is strengthening, supporting, and mobilizing communities and partnerships. Again, this is all about harnessing the will of a community to make change. In the last session we had, somebody had shared that there was a very dangerous street where there were a lot of accidents in the neighborhood, and they were able to bring together the community to advocate for putting a light there. That was a great example of mobilizing partnerships to impact policy. Another one is creating and championing. The example I just provided again is championing a policy. And another one is utilizing legal and regulatory action. So that means if people are being treated with injustice, pointing to the laws that protect against discrimination and so on. So yeah, so Belle, go ahead, you can.
Okay, so with this policy development, I'd like to hear from y'all again. The chat's working really well. If you'll put it in the chat. about what perhaps a time when you helped to bring that change, maybe educating the public, building a partnership championing policies to bring about a change. If you would want to share. And like Vanessa said, the light right at the end of the street, right, made a change, made a difference. So if you want to share with something that you've helped with, I see that meeting with community gatekeepers, right? Housing tenant rights, absolutely. Making sure that people know their benefits, right? That's great. And then how to bring this change, right? How do we make changes? You know, I will tell you, for us, there was a park that was needed. There wasn't anything for the kids to do. And so the community members, the community health workers started bringing a meeting with the members started at somebody's home. And then they united, they got people together. They got different partnerships going, community partnerships, and they were able to build a park in a vacant lot that was just there. So absolutely, things that we can do and that we do as community health workers. So organizing, right? A CHW nonprofit, organizing to bring change, right? Addressing the illegal dumping. Very good. Thank you. Thank you. Bringing a pantry for those food deserts. Very good. Oh, I like that. Having lactation rooms, right? In a San Antonio community. Thank you so much. Also, I guess a community engagement studio to help develop, to help people that need mental health resources, green spaces, opening a church so they could teach free classes to the community. These are great examples. Thank you so much for sharing. I'll turn it back over to you, Vanessa.
Wow, those are wonderful examples. Thank you so much. Again, you do policy development. You may not know it, but you do. All right. Next is assurance. Again, it goes back to the wheel. You can see the blues and the purples. That's the assurance piece. We're going to cover that. Oops, sorry. So that enable equitable access, build a diverse and skilled workforce, improve and innovate through evaluation and research, build and maintain public health infrastructure. So again, this is all about, like, you have the plans, you know, public health departments, they have plans, but then how do you know that the services are being delivered in alignment with the community's wishes and plans? And so that's part of the assurance piece, like just keeping things going to make sure that we're constantly promoting public health. And that might mean that, okay, we're delivering services according to plan, but there are inequities. There are certain people who are not getting those services. Like somebody had mentioned the rural areas, or there are like the food deserts. And so like making sure like, okay, we have these strategies, but there are inequities and we need to address them.
Let me know when you're ready. I'm ready.
So the next is building a diverse and skilled workforce. Somebody mentioned mentoring. Several of you are supervisors for other community health workers, just making sure that you're connecting them to professional development opportunities. What we're doing today is building a diverse and skilled workforce because we're providing professional learning opportunities. Next is improving and innovating through evaluation and research. Again, that is using, like, understanding what's happening in the community and helping educate about what could work to address the issues. Again, putting a light on that street was a solution for the many accidents that were happening. And then build and maintain public health infrastructure. Again, this is human infrastructure, but also the system and the services. You know, you are an essential piece, a human piece of connecting the various pieces of the service of the system.
Thank you, Vanessa. So again, thinking about the wheel, remember the wheel? If I'm going to ask Vanessa to move to the wheel real quick. And thinking about the wheel, right in the center of this wheel is equity, right? Equity. As community health workers and we work on this public health service framework, and we've talked about the 2 out of 3 areas, the assessment, the policy development, and now the assurance, always keeping in mind that it's about the work we do to make sure that there's equity for our community. So the assurance piece, as Vanessa was saying, making sure that there's access to services, that we call attention to these inequities. And I think one of the examples that I heard that brings it, I mean, just it's super clear to me when we talk about an inequity is a bike. You know, they're like, well, we're going to give everybody a bike, but having equity is giving everybody the size of bike that they can ride, right? Not just everybody a bike, but if you're a 3-year-old or a 5-year-old, you want a little, 3-wheel. If you're a teenager, maybe a 10-speed. If you're old like me, I want a 3-wheel again, but a big 3-wheel, right? So again, meeting those, getting those services, accessing those services that are equitable for that individual or for that community, for that family. So thinking about the work that you do as a community health worker and thinking about how, wow, this is all part of public health, the work that we do fits right into public health. This is what we do. We help the public with their overall health, right? So thinking about that, if you want to share a time when you help someone access services or a time when you called attention to an inequity or identified what practices worked or not worked. And then what, if you want to share, what was that like, or who got involved, or, that kind of thing. If you'd like to put in the chat, or even if a couple of people want to unmute and share, we'd welcome that. We got Walmart to donate bikes and scooters to a small low-income town. Nice, right? Nice, because maybe they're needing more exercise or needing to get places. So that's great. Thank you. Thank you for sharing that. I will tell you that many times as community health workers, we are asked to do, sorry, for some reason my computer, okay, there y'all are. I all of a sudden lost everybody. We were asked by a health science center to help promote screenings for men, colorectal screenings. And we're like, oh, what a great idea. Because to me, colorectal, screening for cancer is a great idea. But when we got there, it had been a very rainy season and there was a lot of water, lots of water. We had to wade through the water, and we saw how this community was having to wade through this water to get their kids to get to the bus, right? And so they weren't wanting to discuss about screenings for cancer. They were wanting to see how can we help with this water. So we had to assess the services that were truly needed, not what we thought they needed, but what the community saw was the need. So many times as community health workers, we assess what truly is the need of the community by hearing from the community and not what we believe. Oh, I believe they need this. I believe if they just have access to, just vegetables, that's all they need. You know what? Many people didn't grow up on vegetables. So what can we introduce, little bits at a time so that people start getting used to things like that? Thank you, Ms. Rubina. She says that they participated in food drives, shoe drives, diaper drives, all these kinds of things that they have found are really needed in rural communities. Thank you. What else? What else? I know that some of you talked about working with immigration. Does anyone want to share something that was done with that? Backpacks, right? Going back to school is very expensive. So some people worked in getting school supplies and backpacks to the children. Thank you. So what worked and what didn't work? like I said with us, there we were already, ready, y'all need screenings for cancer. And that was not what was needed at that time. Yes, it was important, but that was not what the community needed at that time.
Hi, Belle.
Thank-
As you know, I'm sorry, I have to go. But thank you all. This was so much fun presenting. Belle, I think we're going to almost wrapping up here. I just put the evaluation tool and the link in the chat just now. So if you scroll up a little bit, you'll see it. I always love doing these presentations. I love hearing the feedback and all these examples. I'm sorry for interrupting, Belle, but thank you, everybody.
Thank you, Vanessa. And again, as Vanessa said, thank you so much. You want to take a screenshot of the evaluation, it's there. I don't know, Vanessa, if you can, or Shay, put the link also just in case somebody is on their phone and can't access the QR code. Really
Yeah,
appreciate
I put it above and I'll put it again.
it. Perfect, thank you.
I'll put it one more time as you're talking. And we might be able to I would love to hear how this went, and please share your feedback with Belle in terms of any kind of improvement. I'm sorry, I'm trying to get the link here. 1 second. There you go. All right, thank you, everybody. Take care.
Thank you, Vanessa. Have a great
fun
day.
to do this with you. Thank you.
So again, we're going to wrap up, but I did want to share, or I did want to hear from you about some of your experiences, just to remember that circle, the public health circle, that framework, the 10 essential frameworks, and remembering that it was assessment, policy development, and assurance, knowing that as community health workers, we play a role in all these things. Thank you so much. And the last slide was just resources that we had for you, but I'm sure that we can share those with y'all as well. And thank you so much for your participation today. I do want to encourage you to do the evaluation, because we want to put out the best product we can to meet the needs of our CHWs. We want to thank you for the work that you do as well. We really appreciate it. Also, this is a series, so I'm going to turn it over to Shay, and she can tell you how you can be part of the series so that you can get CE credit.